This program comes to you compliments of the Tobago Inspirational Network. To support this and other programs, we encourage you to give to TIN. Contributions can be made at any First Citizens Bank at account number 203-4679. We thank you for your support.
Good evening and welcome to today's program of On Call. I'm Thalissa McClure, and of course in studio with me is none other than our resident doctor, Dr. Maxwell at AME. Dr. Max, welcome to today's program.
Good evening, and how are you?
I am fine. I want to know why you're looking at me from underneath like that. Looking like when my little daughter is upset with you, she looks at you like Yes, I am good. How are you?
A little tired, but I'm fine.
God is good.
Yeah.
Don't worry. Your strength shall be renewed in Jesus' name.
Yeah.
All right. So today we have another interesting topic for you. Today we are going to be looking at herpes, but more primarily herpes virus, or what is known as herpes simplex. Right, Doc? I got it right?
Yes, herpes simplex, yeah.
Yes, I got it right. Excellent. So, Doc, herpes. How common is herpes today in today's society?
Herpes simplex, as is known, or there are two viruses, and herpes simplex 1 and herpes simplex 2, called type 1 and type 2. Herpes infection is very, very common, okay, and it is estimated that about 50% of the adult population has been exposed to it, and they may be carrying the virus, okay. Some people do not have symptoms, and they just carry it. Some people's immune systems are pretty strong enough so they can, you know, more or less deal with the virus, clear it out of their system, and they're not having any symptoms. But majority of people who have it and manifested, you can actually see the lesions. And so it's a relatively common infections in the society.
Is this something that you can get rid of if you have the virus? I mean, you know, like the like HIV is an autoimmune disease, and you know, not something that you once you have it you can get rid of. I mean, like they say chickenpox. When you get chickenpox, you have the shingles virus, and that's something that stays in your system. So when we talk about the herpes simplex virus, is it something like that? Once you have contracted it, it stays within your system?
Yeah, unfortunately, that is the sad thing about herpes. Once you contract it, it's in your body. It's not going to go away. You can treat whenever there are outbreaks so that the flare-ups are treated, but the virus remains within the system. Actually, when you come in contact with the virus, what happens is that your body will sense the virus, and then you may have a little act of infection, like most infections, just kind of flu-like symptoms sometimes, and some don't have anything. And then what happens then, the virus will go into the nerve cells, really, and attach themselves into the nerve cells, and they remain dormant there until something that provokes the flare-up, you know, is present, and then it will flare up. Some have flare-ups twice a year, once a year, and depending on your immune system and sometimes the level of stress that you go through, that may determine how frequent you get flare-ups.
Yeah. But how does one get herpes? How does one contract the herpes simplex virus?
Herpes virus is contracted through contact, okay, so someone has a virus and they're carrying it, or maybe they are at a time where the viral load is very high, which makes the shedding very easy and infections very, very common. So you come in contact with them by body contact, kissing, touching, sexual activity, maybe oral sex, anal sex, vaginal sex, all those kind of contacts, you will pick up the virus.
So could it possibly be shed by somebody who has an outbreak, as you say, maybe the viral load is high at that point and shedding, and so I may share a glass with you, and so from that kind of contact, can it be spread like that? Can it be spread by touch contact apart from sexual contact?
Yeah, the herpes simplex type 1 is actually easily contacted most times. Okay, even people jumping up in carnival, okay, you kissing up a little baby, okay, you possibly shaking somebody who've got maybe the sores and stuff like that, hugging up people, you know, and those kind of close contact, okay, and you can pick up the virus. Yeah.
All right. Well, you kind of mentioned what exactly you mentioned it a little bit, but I don't know if you could go into it in a little greater depth. You said when the virus enters your body, it attaches itself to the nervous system, and that's it. It just stays dormant until.
Right, so what the virus has an affinity for nerve cells, so it does go and find out the nerves and attach itself to the nerves. Usually the nerves around the face is usually for the herpes type 1, they attach themselves to that, and that is why you have a lot of outbreaks around the face, the mouth and stuff like that, you know, so because the nerves around the face, you know, will have high concentration of these viruses. Okay, so basically, what the take-home thing is that they normally will attach themselves to cells of the nerves of the nervous system, and they will hide in there, remain dormant in there for as long as they could.
So could I look at somebody, I'm looking at what are the signs and symptoms. Can I look at someone and just tell that maybe they have herpes if they're going through a particular outbreak period? Is that possible? Could you just determine that? Or what do you look for if you want to know whether somebody might have the HSV1 or 2?
Basically, you cannot necessarily look at someone and tell them they have herpes, except whenever they have flare-ups. When they have flare-ups, obviously you're going to see the vesicular lesions, rashes around the mouth, and they have blisters. Some of them will coalesce and possibly form sores, and you have ulcers around the mouth. Basically, you know, on the lips, upper lips, lower lips, that is how you can see that. Some of them will have blisters around the vaginal area or the anal area, you know, so those are the ways you can actually pick up these lesions. But by just watching somebody, if they're not having any flare-up or any rash to suggest that they have herpes, you possibly will not know.
So if you're looking at, is it only, as you say, the genital areas, the genitalia and the mouth, are they the only places that you would see these rash or these lesions?
No, you could have burnings around the lips and the mouth. You can have itching of the skins around the mouth and the lips as well.
So not on the cheek or the nose or the eye?
You could have tingling sensations around the lips and the mouth areas, and blisters all around the gum, the lips, the throat and the mouth, okay, for the type 1 lesions. But also for the type 2, which you can also have these lesions in the mouth in addition to having it in the genitals and in the anus.
Is this something that could be passed down from mother to child? If someone is pregnant and has HSV, can they pass it on to the unborn child?
Right, women could pass it to the unborn child, especially when they have vaginal deliveries, okay. The child passing through the birth canal eventually may pick up the virus at that point in time. So most people who might be pregnant and have the challenge with herpes infections, usually they may possibly have to do cesarean sections to prevent the transmission to their children, you know. So obviously, yes, you can transmit it to your child.
Is that the only way if someone is pregnant to prevent the child from getting it? I mean, I'm just thinking, I'm thinking here in terms of HIV. I know they say like when the viral load is very low, almost non-existent, then there is what they say, like it's
Treatment.
less likely for it to be passed on. So I'm just thinking, is this the same case in herpes? So for instance, if the viral load is so low that the possibility exists that they can have a natural birth without it passing.
No, the treatment is not the same, because for the one you're talking with HIV, that is the prevention of child to mother
Transmission. Yeah.
kind of thing. There's a specific treatment in which, when you put the pregnant woman on these medications, you more or less will be able to prevent the transmission of the virus to the child. These medications are safe in pregnancy for pregnant women, but I cannot say the same thing with the treatment for herpes. So usually the child to mother transmission method of management is different from how you manage for herpes.
So how does someone know that they have, as you say, the virus could be contracted and they might not have any symptoms whatsoever? They might not never experience the flu-like symptoms or anything. It could very well be dormant in their system for a little while. How then do you know whether or not you might have HSV?
Persons who are exposed naturally, you possibly, is the first kind of thing that you will see will be the rash and the blisters, and that will put you on alert that you might have been exposed to that. However, if somebody tells you that, okay, look, I have so, and you've had contact with them, the only thing that you have to do some specific testing in the lab that will pick up this kind of viruses. There are also titer that you do, virology testings and other kind of testing that will pick up and make the diagnosis for herpes infections.
So unless you are told by somebody who has it that you are potentially...
You get a specific screening for it, so you are told about it, or you have a flare-up or manifestation of the disease itself, then possibly then you'll find out. But if they don't tell you, they might not.
Then you'll never.
So there are a lot of people actually walking around with herpes and don't know.
So can someone be resistant to the virus?
I've not seen any case of resistance to virus. However, people may have the virus, and because their body is able to clear up, because our body clear up a lot of viruses that we know might not have been, harmful to us. Okay, and some other viruses, if your immune system is strong enough, even the respiratory viruses that we come in contact all the time, people clear it in their system if they have a very strong immune system, and if they're not, then the virus will overwhelm the immune system and they get sick. Okay, so you could have exposure to herpes virus as well, and because your body, immune system is pretty strong or is able to clear it up, you may not have an outward manifestation of the disease or get sick with it, But
does it mean that it's still in your cells?
Yeah, if it is that you've been exposed to it, obviously, yes, it will be in your system. You may not necessarily have an outward, manifestation in all cases, yeah.
All right, but we got to go to a break. I was now going to go ask you a next question, but I'm seeing the sign that we need to go to a break. So I know if I start asking, the question, we would generally run way over time. So what we're going to do, we're going to stop a bit earlier, right? We're going to take the break now, and then when we come back, we're going to continue with our questions. So you remember, we are discussing HSV, or the herpes simplex virus, and as Dr. Max said before, we went as we started the program, that there are actually two types, type 1 and type 2. So join us if you know somebody who this broadcast might be interesting to. Call them, tell them to tune into TIN, because this is a good program for them to look at. See you right back after these brief messages.
Hi, I am Petunia King Dillon. I'm your host of Family Matters, which is aired every Sunday evening from 7:30 p.m. for 1 hour. Be viewing Family Matters. It's a program that brings stability, healing, deliverance, and reconciliation through the Word of God. All the honor and the glory goes to God. So be viewing Family Matters. God bless you.
Holiness unto the Lord, every Saturday at 6:30 p.m.
Welcome back to today's program of On Call, and if you just joined us, our topic today is HSV, that's the herpes simplex virus. And of course, in studio with me is none other than our resident doctor, Dr. Maxwell at AME. And before we went to the break, I had a question for you, Doc, but I know you want to start it and then come back. So, Doc, we're looking at the fact that, you know, somebody could have the herpes simplex virus within the system and it could be dormant for a very, very long time, but then something or the other could cause it to just be triggered. What are some of the things that can cause the virus to be triggered?
All right, so the virus is in your body and it's gone into the nerve cells and it's resting comfortably, okay? And your body is coping with it, but things happened and you are under stress. And different levels of stress would trigger the manifestation or the flare-up, as we say, of this virus. Things like, you know, physical and emotional stress, okay? You break up with your relationship, or you have a bereavement in the family, you lost your job, and any kind of stress. Studying, you know, different things could happen like that. Fever, even menstruation in women could also trigger that, okay? The stress of menstruation, you know, that's what they call the pre- or post-menstrual stress, you know, those kind of stuff. Hormonal, you know, imbalance, okay, exposure to sunlight. You see these days you have so much high index of ultraviolet radiations, and that also put a stress on yourself and your skin as well, okay. Other triggers may also include just general illness, any kind of illness at all, fatigue, you know, immunosuppressive diseases like HIV/AIDS, you know, chemotherapy for cancers and stuff like that, steroid use in some people, and as well as maybe somebody just having a trauma, physical trauma sometimes. Things like that put your body under stress could easily trigger hepatic outflow.
Does having the herpes virus, does it have any long-term effects on a person's, on your body? Is there anything that, you know, over a period of time?
Not necessarily, apart from the emotional stress and the psychological stress, you know, the body may not necessarily, the virus may not necessarily give you any severe complication per se, apart from the attacks to the nervous cells and stuff like that, okay. By and large, there's not much of any kind of big life-threatening, you know, complications, but people have a psychological stress. Okay, the fact that you have this
and the embarrassment,
the embarrassment and the flare-ups, because I mean, I know people when they get a flare-up like that, you're unable to function on the job for 2-3 days sometimes, especially when they have genital outbreaks. You know, it's difficult. It's pain, is to pass urine, to do anything is very stressful for them, okay? And when they have outbreaks in their mouth and lips and wherever, obviously you're embarrassed, and going to work sometimes, you know, become a challenge for some people because you feel everybody's watching you and
knows what's going on.
You know what's going on, and for instance, there are quite a few people that you can actually see that these lesions are becoming very obvious.
How long does an outbreak usually last for?
Usually about within a week, at most maybe 2 weeks, but most people will possibly recover within a week, you know. And with or without treatment, yes, but sometimes you now want to accelerate your healing process, so we'll give you stuff to kind of, you know, reduce the impact and the severity of the attacks at that point in time. It might be antiviral creams or antiviral tablets that you take for a specific period of time, and that should help.
But how does someone reduce their risk of possibly getting HSV?
Right. Reducing your risk will mean, one, avoiding contact with people who have it. Okay, that is the first thing.
But Doc, if they don't know that they have it?
Now, if you don't know that the person have it, sometimes you need to ask. Okay, sometimes you need to ask. If you're going to be engaging in sex with somebody, you need to ask about sexual histories and whatever it is that they have or they didn't have or whatever. Or you could ask them to do testing to pick up, okay, if there's any problem, okay. But of course, the number one thing is abstinence, but we know that is not always possible in all situations. But if it is that you are sexually active, then you will need to minimize your contact with people, especially oral sex, something that you may need to think critically about, okay, because that is the easiest way that you can pick that up, okay. Unfortunately, condom is not known to offer effective protection against the herpes virus, so it may not always guard against it. So it's just being extra careful.
But I know you were just talking about casual encounter, but I'm just thinking, I mean, you know, it's all these STIs and the virus and everything that's going around. It's more and more marriage counselors are advocating that before a couple gets married, you do the battery of tests so that you are aware of what you might be getting into. So for instance, a couple is getting married, all right, and they did the test, and one may have HSV.
Correct.
Then how do they deal with that? Because as you say, even is it that they're not going to procreate because if they decide to get married, are you saying then don't get married because somebody might have herpes? Is it then that if they decide to get married, how are they going to deal with this? Or is it that the other person is going to say, you know what, I accept the fact that you have herpes and that the possibility exists, I will get it too, and so I'm comfortable with that? I mean,
all right, those are personal decisions that individuals have to make. I have seen people, even with HIV, who decide, look, both of us are HIV positive, we're still going to get married. That's not a problem. They make the informed decisions, okay? And I've also seen people who have, you know, herpes, and they still decide, okay, we don't know who had it first. They were dating and they realized, okay, well, this one have it, so I can't put a timeline as to when it was contracted in terms of who had it first and who gave it to who. So, but they decide, okay, nevertheless, we love each other and we
but that's in the case where both of them had it.
Okay, now I have also seen situations in which one person realized, okay, this is the case, and they said, look, I am gone. And that was the end of that relationship. So this kind of things is on individual basis. So you let the two persons know what is happening, let both of them do the test and be sure they have it or they have it or whatever. And that's it. And I've seen situations in which somebody have an STD and the other one don't have it. And even though the other person is being treated, the other person insists that they don't have it, and some refuse to do the test. So there are different scenarios that you're confronted with. But the most important thing is that each person will be offered the benefit of what is the situation, the restriction, what are the options, and they make their decision as to way forward or otherwise.
Well, let's talk about treatment. We didn't talk about treatment. Can treatment help to prevent multiple outbreaks if you have HSV, or help to prevent outbreaks in general?
Not necessarily, because you never know when you're going to get an outbreak. Sometimes it just flare up as a result of stress, and sometimes the evaluation of that stress is also subjective. Some people might think I'm under stress, and people think, no, they're not under stress and whatever. So in terms of giving a pre-exposure or pre-outbreak medication, I don't think that has been the mainstay of management, and I don't think that is something that is widely used, okay, so that people who anticipate, you know, that, no, I'm stressed, so let me start to take tablet to prevent. People don't do that routinely, all right? I'm not too sure if it's something that is practiced, but the only thing we know is whenever you have any kind of outbreak like that, we try to, you know, give you some kind of treatment and see how we mitigate against the, you know, the severity of outbreaks.
So is treatment only administered when there is an outbreak?
When there is an outbreak, all right, and that's the mainstay of treatment.
So all of these, I mean, I've seen commercials non-locally, of course, I mean, most internationally, that say, well, if people have a herpes type 1 or type 2, this one pill can do whatever and whatever, which seems to suggest that there is a regimen that you can go on to prevent outbreaks of such. I mean, is that possible?
Well, there may be. I've not seen those adverts. However, if there might be some kind of prevention thing out there. I mean, for example, in HIV/AIDS, there's what they call post-exposure prophylaxis, in which, okay, you had sex last night and you feel, or you've eventually found out, okay, the person might have been positive, or like for hospital workers who possibly get accidental needle injuries and stuff like that, you give them a post-exposure prophylaxis, which is PEP. However, in recent time, there is now what they call the PrEP, which is the pre-exposure prophylaxis, in which a lot of these folks in the maybe the LGBT people who are gay sex and stuff like that,
in the sex industry,
wherever they will purposefully take HIV medication in anticipation of having sex with somebody who may be HIV positive, and that is found to prevent them from getting HIV. But that means every time you have sex, you have to take that. Okay, so there are treatment modalities to that effect. So I won't be surprised if that is happening in other STDs as well.
It's possible. So, Doc, we're about to wrap up the program. All right, we're about to wrap up the program. Is there anything else that you think that we didn't touch on that you want to highlight now with regards to the herpes simplex 1 or type 2?
Well, basically, the only thing that we didn't touch much was the genital herpes, which we say, okay, look, both type of herpes, either type 1, type 2, you can get it on the genitals. Okay, so the most important thing is for you to minimize your exposure to oral sex, okay, because that will significantly reduce your risk, okay, and if you're going to do that, there are mouth guards and other things that people use to, you know, limit their exposure. So if you know anybody with sores on their genitals or with rash on their genitals or on their mouth, you might be wise to avoid any kind of sexual contact.
But Dr. Marks, for instance, I mean, I think I heard it was a pastor say this once. I don't even remember where I heard it. But the custom of having sex in the dark with the lights off and everything, how are you supposed to see what is going on the genitalia of your partner? Well,
then you might need to start reconsidering that turn out the lights kind of scenario in which you don't see, you know, where you're going, and you don't see what you're interacting with, and you don't know what is there. So I think sometimes you may need to turn on the light and examine where you're going, because I had a very strange situation sometime. I see a young woman with genital warts, and the warts look like cauliflower rashes that cover the whole of the vagina opening. And surprisingly, she was like about 5 months pregnant. So at the back of my mind, I said, how did somebody get inside here? You know, so I was like, okay, you know. So, but if she had been caught earlier, the genital wart would have been treated, but that wasn't done. But she was pregnant in the process of the whole thing. But the whole vagina opening was
Which meant that
covered.
Somebody probably turned off the lights.
So I suggest that you turn on the lights and examine where you're going and be sure of what you're dealing with before you, these days, a little precarious when it comes to that, so you need to be careful.
Dr. Max, thank you so very much for your time. And of course, always prevention is better than cure. And in this case, there is no cure, there is only treatment. So that's it for today's program, folks. We've been speaking about the herpes simplex virus, both type 1 and type 2. Of course, if there's anything that you would like us to discuss or any questions you have, for us, you can always email us at tobagoinspirational@gmail.com or give us a call at 297-6602. Have a blessed evening. Bye for now, until next time.
This program comes to you compliments of the Tobago Inspirational Network. To support this and other programs, we encourage you to give to TIN. Contributions can be made at any First Citizens Bank at account number 203-4679. We thank you for your support.